Good afternoon, everyone. Thank you for joining today's session. My name is Aisha Dixon. I'm the director of the Maritime Retirees Relations Center, and it's so good to see so many of you here about our talk on Medicare. Just a few housekeeping items. I'm going to mute everyone so that you don't have the option to unmute yourself in case there's a dog or landscaper in the background. We want to make sure we have our full attention to our guest speaker today. Please feel free to use the chat feature if you have any questions during the presentation, and we'll try our best to get to them all. We are recording this that will be uploaded to our YouTube channel later, so if you have to leave, please feel free to go ahead and do that, and then I will send out an email with the video that's posted to our YouTube channel. We at the Emeriti Center have a small team, so I want to introduce our colleagues, Lam Liu, who is here, as well as Maria Lubrano, who organized and coordinated today's speaker. So Maria, please go ahead and introduce our speaker today.
Thank you, Aisha. I want to add my hellos to everyone also. And then just to briefly give you some information about our presenter, Michael Mckinley. He's a staff pharmacist at UCLA Health. And welcome back again, Michael. And he's been working in pharmacy since 2008. He's past director of pharmacy from UC San Diego. He received his bachelor's of science in biology from Loyola Marymount. And he is here to try and help us understand the very complicated maze of Medicare. So without further ado, Michael, whenever you're ready.
Thank you, Maria. I appreciate it. And then since a lot of, if I remember from last year correctly, a lot of the questions will go into the chat. Can you guys just maybe at the end have some of those written down so we can address the most important ones quickly?
Yeah.
And then let me go ahead and share my screen so you guys can see my PowerPoint that I've created. So share. All right, so can all of you guys see my PowerPoint that I've created? Yep, perfect. All right, so we're going to go over Medicare today, everybody. So, I will do my best to make this as simple as possible for everyone. Just a small disclaimer that this is just a presentation of information as like a consult basis, but please use it as information to make the best decision for yourself. As with all prescription drug plans, which is the main focus of today's conversation, they are so specific to each person, so that I ask that you just kind of use this as tools. I'm giving you tools to make the best decision possible for yourself. So, whatever, if I was to get Medicare today, what I would need would be far different than what anyone else would need, because they are so unique based off of each of our own medications. So just like Maria introduced, my name is Michael Mckinley. I went to UCSD for pharmacy school. I worked at CVS before coming here to UCLA. I've been at UCLA now for just over 2 years. So I got in here right before the shutdown happened. And then I have worked in pharmacy overall since for about 15 years now, just like Maria said. Just want to give you guys a little background of our pharmacies here at UCLA. If you aren't familiar with them, so we have 5 total retail pharmacies. So we service the hospital, we service transplant patients, specialty patients, and regular retail patients. We do offer mail-out services. If you guys do see clinicians here on campus, feel free to use our pharmacies, and we do mail via FedEx to your house. We work in collaboration with prescribers if you're on specialty medications, where we would reach out to everyone, at least on a monthly basis, just to make sure everyone does well on their specialty meds. So if any of those things are of, interest to you, we can talk about that offline at another time. Maria can share my contact information with anybody who has those questions. And we also do immunizations in one of our pharmacies. We're doing some COVID shots. I know that's the main topic of conversation recently. All of those shots, those are not on a walk-in basis or appointment-only basis that you would do via MyChart. If that all, if any of you guys still need to be boosted, that's something you can look into. All right, so the main part of our agenda is to just kind of briefly go over just all the branches of Medicare, the differences of drug coverage. So there's, different drugs are covered under different parts of Medicare. I'm sure we've all heard of, the lettering system. We have A, B, C, D, and F, and more than that, but that's where we'll stop at. The main goal is to find out how Medicare Part D works. And then we want to know about eligibility and enrollment. That's why we're here. When can we enroll? What makes us eligible to enroll? If we qualify for extra help with Part D medication costs. And then lastly, we'll spend a little bit of time going onto the Medicare website so you can choose the plan that's right for you. All right, so first of all, who's eligible? So for most of us here, we will fall under the people who are 65 and older piece. There are people who are eligible for Medicare who are less than 65 with specific disease states. Some of those being ALS, if they are disabilities since they were a child, less than 20, if they were born with a disability, and also people on end-stage renal disease or requiring a kidney transplant. People do have to be a U.S. resident, and if you're not a U.S. resident, you have to have been a citizen. You have to be a resident and a citizen who's been lawfully admitted as a permanent resident for greater than 5 years. The different branches of Medicare. So we have Part A, which that covers our hospital bills. So that's inpatient or hospital coverage. We have Part B, which is going to be your outpatient or medical coverage. So when you go visit your doctor's office, you will get, they bill what's called Part B. Most immunizations will go through Part B. So like your flu shot, COVID shot, will go through Part B, and then Part D will cover some of the other ones. Part C is what we call an Advantage plan, which we'll go through later. It's kind of bulking everything together. Part D is for drug coverage. And then just want to go a little bit over Medicaid versus Medi-Cal. They're both state-funded insurances. So Medicare is, for elderly, like we had just talked about, and then people who are on Medi-Cal are either, disabled children or people of low income. And if you were on a Medi-Cal and you become Medicare eligible, typically, if you do qualify, they will roll you straight over to Medicare and help with assistance on that. Nothing that you guys would have to do on your part. But that is all based off of income status and the limits that they put on the poverty level, which I don't have on this presentation. That would be on the Medicare website. So for Part A, this will update basically every year. It kind of goes along with inflation, any costs that I go through. So most of the premiums are free for people who want to purchase Medicare Part A who didn't enroll in it in 65 or are trying to get it before 65. There is a premium to that, but because we will mostly fall into the 65 and older and just rolling into Medicare, premiums will be free. You do have a deductible that starts at $1,556. So that's probably up, about 2% up from last year. So you'll see that rise slowly every year. Your deductible will change annually, and that's just based off the inflation amounts. But that's what it is for 2022. And then what we care about is inpatient hospital costs. So it's all based upon about days in a hospital. So for days 1 to 60, it's free. They cover everything. Days 61 to 90, you pay almost $400 a day. And then after day 91 and beyond, you pay up to $800 a day. However, for day 91 and above, that's 60 days per lifetime. And now this is not total hospital days. This is going to be broken up to different time periods. So this would probably be one continuous stay or a stay that does not occur within the same 30 days. So meaning if you discharge from the hospital today and in 6 months you get back into the hospital, it should start from day one again, if I remember, I read the website correctly. But if you were to leave the hospital today and come back in a week, and you're in the hospital for 5 days, when you come back in 1 week, that will be day 6. So that's how that will count. Part B is going to be your medical insurance. And so your premium starts at $170.10 per month. Now, what does that mean that we start at? That means these premiums are based off of income. So based off your tax returns from the previous year, that'll determine what your monthly premium will be for Medicare Part B. You will pay 20% co-insurance for any approved service, but that does not include that we have a deductible this year of $233. So last year was probably about $215. So we will continue to see that rise slowly year by year. Preventative services are completely covered. So like flu shots, going for your wellness exam, anything like that will be 100% coverage. But to see the complete list of services and costs associated with them, you can see that on the website. So doctors cannot just choose to upcharge you because they want to make more money and have you pay a higher percentage of the copay. These are all pre-fixed pricing that is done by Medicare, which the doctors have to adhere to. So going off that website will allow you to see or anticipate what your costs will be in a doctor's office. So Part D is probably our most complex part of it, and that's why we're here today, is mostly to figure out what we're going to do for Part D, as in David, for drug coverage. So this is going to be in addition to A and B, and you will have premiums associated with it. As for what each premium is, we will show later on, how they can vary and why they would vary. It's mostly based off of what drugs you're on and how you want your payments to be broken up over the year. Usually, between each person, the payments throughout the year will be about the same. It just depends how it's broken up. If it's broken up more into your premiums or more into parts of your drug coverage, like your co-pays and deductibles. And then Part C, I want to touch on, it's a Medicare Advantage plan. So this one is where you basically bulk everything into one plan under a commercial insurance company. So many of you guys might have heard of Scan or Express Scripts or Humana or Anthem. All these places have their own Medicare Advantage plans. So basically, you would sign up with them. You would still pay your normal premiums, but it would go directly to the Advantage plan, and they would handle everything for you: hospital, medical, pharmacy coverage. One thing I will say is kind of a caveat to these Advantage plans: there are HMOs and PPOs, and you should do your own research on see what the difference is between each one. It's almost like getting just regular commercial insurance. But I will say this: if any of you are a transplant patient or a future transplant patient, or you're worried about that, or a family member who may have that, any transplant coordinator I talk with recommend to stay away from these HMO Medicare Advantage plans, because you will pay far more for your drugs through that plan. That would protect any transplanted organ. So I just give that as a side note, since I have a lot of experience with it. Right. We also have Medigap or supplemental plans. So these are, a lot of people tell me, oh, I have, Anthem supplemental plans. So these are your plans F, G, H. They have all the letters of the alphabet online listed, and they all cover different services. None of these assist with drug copays. I want to make that crystal clear. If you want help with drug coverage, it's Part D or Part C, the Advantage plans. This will help with vision coverage, lowering copays through doctor's offices, assisting with copays for, if you have to have any x-rays or MRIs, any of those type of things. And depending on which plan you choose, there will be a different premium, and they have a grid of what they each cover. This is the grid you can find on the Medicare website, showing all the different coverages between, so we have our alphabet soup here: supplemental plan A, B, C, D, F, G, all of them. So what I would just suggest, if this is something that you want to get in addition to your standard A, B, and D, please go to the Medicare website and do some research to see what would work best for you. Okay, so I want to spend most of our time remaining, we'll talk about Part D plans. I also want us to have ample time for questions because I do know this is a lot of information coming at you quickly, and if we need me to jump back on any of the other items, I want to leave time for that as well. So to be eligible for Part D, you do have to have Part A or B. You also must have no other drug coverage. You can't not use Part D and a commercial plan. It's one or the other. You can, however, have Medi-Medi. That's meaning you have Medicare and Medi-Cal. If you are a low income patient that is a certain percentage below the poverty line. What percentage it is, I am not sure. If you are enrolled in Medi-Cal already, they will automatically enroll you in Medi-Medi if you qualify once you turn 65. So initial enrollment, because we need to know when to enroll in all of these plans, right? We can join a Medicare plan when you first become Medicare eligible. So that is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So you have 7 months to enroll in it initially. Right? And then annually we'll have open enrollment happen, which is going to be from October 15th to December 7th. So for example, this year in 2022, if you would have had to enroll between October 15th and December 7th of last year for your coverage for 2022 to start on January 1st. So the same thing goes for this year. Next, at the end of 2022, between October 15th and December 7th, your new plan will start on January 1st, okay? So regardless of if you just turned 65 this month, please, don't forget about open enrollment at the end of the year. Your current plan will usually only cover you until the end of the current calendar year. You can do Advantage plans. Those are going to be registered at the beginning of the year, so from the 1st to the 31st, and those I will believe run from July 1st until June 30th is typically how the Advantage plans work. So they're on different calendar times, which makes things nice and complicated for us. So typically what I've seen in the past is people on Advantage plans will stay to Advantage plans, and people with the standard A, B, and D will stick to that as well, just to keep it in the same calendar for them yearly. And you can enroll outside of open enrollment, but you will be charged a fee for that. All right, so just kind of some tips to follow when we're thinking about why do we want a Medicare plan, or what plan do we want, is first of all, do I take any prescription drugs? Some of us may be very lucky and are on no prescription drugs, and we don't feel we need to pay the premium for this. Another thing people will talk about is brand versus generic prescriptions. If there's some generic prescriptions that if you guys have ever filled at CVS or used coupon cards like GoodRx, that can be fairly cheap, and you may not want to pay the extra cost for the premium if your copay is going to be relatively close to the same. But brand prescriptions are much more expensive. So if we're on something that's a brand name, this would definitely be of interest to us. Some people like to have peace of mind, right? Meaning if you don't have any medications, but you still want to have peace of mind, you can select a plan with a lower premium to just cover you from those, high expensive, if, God forbid you have an accident, end up in the hospital, something unexpected happens, you can incur, expensive drugs very, very quickly. I've seen it, every week someone comes in, they have Medicare A and B, but they didn't have D, and they got started on a blood thinner that costs $400 a month. So some people will just go with a lower premium plan just for peace of mind. And then if you do like convenience and having everything in one place, then Part C may be the choice for you. That's the Advantage plan, where everything is bulked together. Okay, so Part D coverage requirements. So this is just by law what Part D requires for all patients for certain disease states. This is not things that you will typically see, but that's happening behind the scenes that you may find out about when you go to pick up your medications. So first of all, there's I don't know if everyone's heard of, but there's been talk over the past, 10 years about the opioid epidemic throughout this country. So all Medicare plans will run a pain medication safety check and force the pharmacy to ensure that if anyone's on pain medications, and especially if it's the first time filling it with Medicare, to do a history to make sure it's a safe dose that they've been on before, and if not, to contact the doctor regarding the safety of it. They look at if it interacts with any of your other drugs, if you're on many medications, and they also try to limit the amount of pain medications that you receive unless you need it for a specific purpose. So for example, if you go to the dentist and they prescribe for you Vicodin, they will not allow you to do more than 7 days at a time from a dentist because typically dental pain is very short-lived. But that being said, if God forbid you have pain related to something else like cancer, all they would require is for the doctor to fill out paperwork and they will approve, the amount of pain medication that the doctor deems necessary and safe for you for your cancer treatment. They do what's called prior authorizations. I'm sure many of us have ended up going to the pharmacy. The prescription's not ready. It's not covered by my insurance. They need the doctor to talk to the insurance. So basically that's saying the insurance is requiring the doctor to submit paperwork onto why you need, drug X when drug Y may do the same job and is, far cheaper for both insurance and patient. The doctor will normally provide that paperwork and then get it approved. Quantity limits is kind of what I've talked about with the pain medication. It's all based off of how drugs are approved through the FDA. Step therapies are just another word for prior authorization. Basically, there's a medication that is higher cost. They want you to have tried the cheaper ones first before they approve the higher cost ones. Part D also covers some vaccines. So many of you will be wanting to, get the shingles shot so we don't get shingles. That would go through your Part D benefits. So Part B covers some vaccines like I talked about before, and Part D will cover others. And then drugs received in, outpatient hospital settings sometimes will be not covered through Part D, but will be covered through Part B as in boy. So that's something I mentioned earlier. Those drugs are nebulizer solutions, some cancer medications, some immunosuppressants, all of that. The pharmacy knows. They'll bill your Part B. You won't even see it on your end, most likely, unless they need your Part B information. All right, so now let's kind of go through the website. I'm going to bring up the Medicare website to show us how we can compare certain medications so that we can see what it looks like, and we can use this tool to help us pick the right plan for us. Let me share my other screen. Too many tabs open, just bear with me 1 second here. Right. See here. So are you guys seeing the Medicare website now? Can I get a thumbs up from some people?
Yes,
Thank you.
the
Perfect.
happy
So
couple with coffee.
yes, I need more of my coffee today. I didn't get enough this morning. So this is our Medicare plan. So Medicare website, just medicare.gov. You Google it. If you click on the first link, this is where it pops you up to. If you're just looking to find out about drug coverage quickly, we're going to go to the Health and Drug Plans tab up here. But I just kind of want to show you the layout of this. You can find all the different steps, and to find all the information that I've gone over is readily accessible here as well. So we'll click on drug plans. Then we want to, we can either find drug plans, compare coverage options, whichever ones we click of this, it's going to end up getting us to the same spot. Going to put in our zip code. So I'll put in UCLA, zip code. We want to go with Medicare, the original one, which is Part D, or the Advantage one. So you would make that decision here, or you can compare them. I'm going to go with the original Medicare because that is the most common form that I see. And because the main focus of this is going to be drugs, because that's the most complicated part, I'm going to just select that item. And, we're going to compare plans here. So when I select, if you notice when I deselect or select the drug plan, it will change this check mark next to drugs here. If I selected Medicare, then it helps with out-of-pocket expenses. So we're going to just unselect that. And then it shows what the drug premium range is typically in our area. And then we can go through this to see if we can look at our different plans and add some drugs to it. So do you get help from other, with your costs from any of these programs? I'm just going to say I don't get any help for right now. But you can select what works for what each of you get. Do I want to see my drug costs as we compare these plans? Yes, I do. Now we're going to search for drugs. So I have some common ones. I put a couple of cheap ones and a couple of expensive ones. So ones with generics and ones without that I see, dozens of times a day. I'm just going to add them in quickly. So metformin, it's very common for us to, if we have blood sugar. I'm just going to do a standard dose for it. Add Eliquis, which is an expensive blood thinner that I see every day in the hospital, that they use for many things. If you have heart surgeries, if you have hip replacements, knee replacements, they typically go with Eliquis. And then add that. Add another drug, blood pressure medication. And we're going to add one more blood sugar medication that I see commonly that is, I want to go with one that we see that they use for both heart and blood sugars. So we have our list of drugs here, and you'll continue adding and subtracting, and you're going to put how much you take per month. So I just went with standard doses. All of this will be specific for each of you. All right, I'm going to be done adding drugs. I'm going to just find pharmacies around us and add them to my list. So I'll choose one of our pharmacies here, because this is going to compare pharmacies. I'm going to choose CVS. I'm going to choose Ralph's, because those are all the ones I'm interested in to see how prices can vary. All right, and then now we have our plans. So we can sort our plans by different options. We can do lowest monthly premium, lowest deductible, or lowest total cost. So I'm just going to go with lowest total cost, and it will tell you here how much your premium is for the drug coverage part only. This is only for the drug coverage, so you will still have your Part B as in boy premium. This is what they anticipate me spending annually for both premium and my prescriptions. And then this is going to be my deductible. Okay, I can click on plan details if I wanted, and it will break it down for me. So CVS is a preferred pharmacy. Ralph's is also a preferred pharmacy. UCLA is standard, and it will tell me different prices for each drug annually. Okay, so see, CVS is a little more expensive than Ralph's. And they're both a little cheaper than the UCLA one here. You can extrapolate that all the way down to our total yearly drug costs right there. And it also kind of tells you when you meet your deductible. So your deductible is that initial benefit where you're paying the majority, if not all of your drug costs. It will tell you when you enter the gap. So this is something that I want us to talk about, because this is different for everybody depending on the price of medication you're on. You will enter what's called your donut hole or gap coverage when you hit a certain dollar amount that is set by Medicare on an annual basis. Once you hit that dollar amount, you will enter the donut hole or coverage gap, where you will pay no more than 25% of your covered drugs. So you'll either pay the total cost of the drug you'll pay 25% of the drug unless like the total cost is under a certain dollar amount, which would be your normal, probably your normal copays. So you'll see in July, we will see an increase in our monthly copays until we get onto the other end of the coverage gap, which you would have to ask your Medicare plan how big that coverage gap is. Once we get out of the coverage gap, which for me in my drug list right now won't happen in the year 2022, then we would enter what's called the catastrophic phase, where you pay a lower percent, somewhere between 5 to 10% of the total cost of the drug until the end of the year. Okay, so if some of us are on 10 different meds, and that is including insulin, typically you'll enter the gap probably earlier in April or March, but you may get out of the gap by September and pay a lower cost after that point. All right. So, and that reflects right here on our monthly breakdown of meds. So it looks like I'm in my doing my deductible here. We have my regular copays totaling $84. And then you see in July, I hit the beginning of my donut hole at the end of July, and I'm fully in the donut hole for the rest of the year. Okay, so that's all reflected. It's all broken down month by month here, so you can predict if nothing were to change to your medication regimen, what would happen here. Okay. One thing I do want to point out is you can see the total cost of these, and you may think, wow, these costs are pretty astronomical for the two medications, you know, as a yearly cost. This is where you would come to either A, your pharmacist, or B, your doctor, and you can show them this and be like, hey, is there something that is better for me, or is there something that we can do to help mitigate this? If this is the plan we are stuck with, you can also, we'll go back to our different plans where we can compare them and see what the total cost will be. So one thing I'll do is you can select plans, multiple plans here, and we can compare them to see how they differ. You'll see that the total yearly cost may not be too different. So we're looking at $2,400 here versus almost $2,500. But here we don't have a deductible, so it might be a little more even throughout the year instead of higher amounts at the beginning and lower amounts towards the end. I'll just scroll down and it'll tell you how much at each pharmacy, like we saw before, to compare them. And then we can go one by one into plan details like we had just looked and see how the prices of drugs differ for each plan. So same thing. Everything looks basically the same here because except for when we get here where you notice we don't have that $500 up front like we did in the previous plan. We start lower and slowly work our way up to our donut hole, which that number is the same because you're paying a percentage of your copays. But your monthly regular copays are slightly higher compared to before because we don't have the deductible to compensate for not having the deductible. So that's where I really ask people to, when someone calls and asks me at the pharmacy, hey, Mike, I'm new to Medicare, or Mike, I don't like my Medicare Part D plan. What plan do you like? I just tell them, I'll be honest, I don't have one that I like or don't like because they're so individualized nowadays. The best thing you can do is go to this website and search for medications here, and it will tell you broken down how each drug will cost for you. This is the best thing you can do. If any pharmacist tells you, I prefer plan Scan, plan Blue Shield, plan Humana, they're just telling you the ones they see all the time. It may not necessarily be the best plan for you. It's just ones that they see that are popular, so they typically think they are the best. So let me go ahead and I'm gonna bring back up my PowerPoint slide. Let's see our time. We're doing good on time right now. So, okay, we see the PowerPoint slides again. All right. So on the PowerPoint slides, we do show the coverage phases that I went to and spelled out for us, okay? So initial coverage, that's our copay after our deductible. Typically what I've seen for patients, it will be roughly anywhere from $0 to $10 for generic medications and anywhere from $25 to typically $47 for the preferred brand name medications. If it is, depending on each plan, certain drugs will have higher than that, but those are the numbers that I see most regularly. Coverage gap or donut hole, where, like I said, we pay up to 25% of your cost until you spend. It'll be around $6,550. So that's how big the donut hole typically is, depending on your income status and your, tax paperwork from the year before. You may qualify for extra help. Catastrophic phase, that is after we reach the end of the donut hole, where you pay no more than 5% of your drug cost. Like I've mentioned before, supplemental plans will not cover any extra of your prescription drug expenses. Okay, they will cover medical expenses, not drug expenses. So some of the extra help that I've mentioned before is just spelled out here for us. So it is available for patients with low income. So LIS means low income status. So if you are enrolled in Medicaid, you do not need to apply for low income status. If you believe you do qualify for it, you can go through the Medicare website and apply for low income status, and they will look at they will ask for your tax documents, and they will either approve or deny you for it. Some medications that are extremely high cost may have patient assistance programs. That being said, most copay cards that you can use when you have regular commercial insurance do not apply to Medicare. There are some that do. When you have an injectable medication costs $5,000 a month without insurance, or even with your insurance, they may have some patient assistance programs where you can go directly through the manufacturer. Okay, so if that is something that you are worried about, you can always contact our specialty pharmacy or our pharmacy in the level 1 area to see if that medication is typically one that that they see that will qualify for patient assistance programs. Or you can literally go into Google and type in the medication name, patient assistance programs, and it will pull up the company's website for you. And then they have a phone number for you to call there. All right. Just a little bit more about just the Medicare Advantage plans. We've talked about this before. It provides all benefits, drug coverage, and A and B. They're both HMO and PPO. So when we're talking about HMO and PPO, that's just like we had before with commercial plans. With PPOs, you don't need referrals as often as HMOs. And then there are fee-for-service plans. These are typically cheaper, but they do not cover drugs or medications. So I do not really see many of these plans in the market. Okay. So the Medicare Advantage plans, we can go back to that other screen, and where we went to the drug plans, we can do just a quick one with the Medicare Advantage plans. And that's going to be the last thing we go through, and then we'll have time for questions. So let me pull up the Medicare website again. And we will go look at an Advantage plan real quick, just so you can see what we're going to be looking at. Okay, so we are back on the Medicare screen, and instead of the original Medicare, which we went through before, we'll go through our Medicare Advantage plans. And because we're on the Advantage plans, it won't let us select anything here. And then we can look at our plans like we had discussed. We are not going to get any help like we talked about before. We're going to do the same area. We're going to do the same drugs, just so we're comparing apples to apples, and we'll do the same pharmacies. And it is going to load our different plans. So we have, like this is the same thing. We'll sort by lowest total cost. It can be lowest deductible, lowest drug deductible, premiums. It depends on what fits your need. If you have a lot of medications and you want to make costs even throughout the year, then, that's fine. Or you can do, you can just compare and see how it goes from January to December, what would work best for you and what you prefer. Someone like me, I like the same costs every month, so I can plan and budget for it. So even if I'm spending maybe $10 more over 12 months, I'd rather have it be all the same than, $500 one month and nothing the next month. So this will show you what your monthly premium is. Remember, you still have to do your Medicare Part B premium on the side. So this does not account for that. So this total is really going to be $170.10. This is going to tell you your drug cost, if you have any deductibles, and then what your maximum you'll pay for health services. You go into plan details, and same thing, as you can see all the different costs here for premiums, deductibles, what we'll pay for services, what our copays will be. So you need a referral required for a specialist. So all of these different items, it'll break it down for you. Okay. Benefits and costs. Okay, so this just goes all the way down on what everything will cost. So everything, in network will be great, and anything out of network you'll see will have different costs associated with it. So in network hospital costs will be $0 for certain hospital services, and then preventative services, ambulance, just lists everything here. You really just got to deep dive into it on your own. I think just going through it all here would just be overkill. If this is something that you're interested in, I highly suggest just comparing a couple plans and seeing how it works for you. It does provide a lot of convenience with everything being in one spot. Okay. And then that is all I have on the next slide are the references, which is just the Medicare website. Besides that, we have about 15 minutes here for any questions that people will have.
The first one we have, Michael, is
Yes.
if money was not an object,
Yes.
how wonderful would that be?
Yes.
What is the best supplement as a UC retiree?
So best supplement in regards to, so I'll go with, so best supplement in regards to prescription coverage, you want to just go with what works for your prescription drugs. If we go back, I'm going to bring my PowerPoint back up. And are we seeing the PowerPoint right now, everyone? If you guys, I'll just make sure I share it again. No, I did screen one, not the PowerPoint. There's the PowerPoint. So if money is not an option, I will choose whichever one covers the most services here, which looks like Supplement Plan F. That's going to give you the most coverage overall if I don't have to worry about expenses. So I would pick my drug coverage based off of my personal medications. I personally would do something that makes my drug coverage, about equal every month. And then I would do the Supplement Plan F because it has the most help.
Okay, thank you.
Mhm.
If I am already receiving Medicare as I am on disability and enrolled in UC PPO, do I need to enroll in anything else when I turn 65?
So that would be I believe you would double check with the office, but I believe you would have to see if your UC PPO would continue. From what I've read in the past, and please, Aisha or Maria, correct me if I'm wrong, the PPO plan may cover you until you reach Medicare age, but you may have to go over to Medicare at that time. I don't know if they will supplement less if you do not convert over to Medicare.
That is my understanding as well, but RASC is the contact for that.
Okay. So
Yeah. Mhm.
Yeah.
Okay, let's see. How soon before turning 65 do you need, okay, we addressed that. You need to apply for Medicare, was it 3 months?
So you have your window will be 3 months before you turn 65. So let's just say our birthday is April next month. You can do it from January to March. Those are the 3 months before, April, and then June until September. You have 7 months of the year to apply for Medicare.
Thank you. If I have Medicare and UC PPO, do I also need to buy a medical supplement, or is this maximal coverage?
So once again, that will depend on if the retirement will still pay for your PPO. If your coverage remains the same with the PPO, exactly the same, no changes, then you should be fine if you don't want the supplement coverage. But you need to double check with retirement if after you become Medicare eligible, if they will change what they cover or your maximum out-of-pocket expenses.
Thank you. Next question. I currently have HealthNet. When I turn 65, my understanding is that that will convert to United Healthcare. Do I need to get Part D, or are meds covered under United Healthcare?
The question will be are they an Advantage plan? I have seen it both ways. I have seen Medicare, I've seen United Healthcare with a drug plan. I've seen United Healthcare without a drug plan. So big question is if it's a Medicare Advantage plan, then, and on your card, it will have on the bottom right-hand corner, the prescription information will say RX bin, RX group, and RX PCN. That's what I look for as a pharmacist. If that is not on the card, it does not have prescription coverage.
Okay. What if I retire outside of California?
Medicare is nationwide. The cost should be the same. This is not a California cost. This is nationwide. If you're using the retirement plans that we've talked about in the past, I would say still talk to UC Rays about that. But in regards to Medicare and what we went over, it should be the same.
Okay, next question. I thought the UC open enrollment period is the time to choose or switch Advantage/supplement plans for UC retirees. Could you confirm?
So UC open enrollment would be if you're still getting the plans through the UC. Medicare open enrollment would be if you're switching over to Medicare. And just like I've discussed before, double check with UC Rays on how your plan will change once you become Medicare eligible.
Next question. If you want the optimum choice/choice of doctors, chiropractic, acupuncture, which would be the best supplement?
Let's see here. I mean, I think going back to before, it'd be supplement F. And you know, that will just supplement any copays. You would have to also, you know, if you have to decide if you're going regular Medicare Part B, and if your doctor accepts that or needs to, you know, if you see a lot of specialists, if they accept that, you may need referrals. If that is worrisome to you and you want everything readily accessible, you know, Advantage PPO plan would be something to look into as something to make it more readily accessible to you.
Next question. Is a non-working spouse also eligible for Medicare benefits based on working spouse's record?
So Medicare is individual. So you have to sign up for Medicare on your own individually. So if I'm working and my wife is retired and we both want to go on to Medicare, we apply for our plans individually because you do not fall on each other's plans. Everyone's eligible for it, and you know how much help you get or what you qualify for. If you're worried about low income assistance, it's all based off how you file your tax returns. But everyone 65 and over who's a citizen or have lived in legally in the US for 5+ years is eligible for Medicare.
Okay, still shooting questions at you.
Yeah, that's fine.
If I choose one of UCLA's Medicare plans, do I still have to sign up for Medicare from their website?
So that would, my gut feeling is no, but I would verify it with the UC Rays. I don't know entirely about that. That is all fault. Unfortunately, with the retirement parts, I am not as familiar as I would like to be. but I would double check with them. Usually what I see, if they have a Medicare plan, it will be a Advantage plan of some type through the employer, because it's all through one spot through a commercial insurance. So my gut feeling is no, double check with them.
And then we have a recommendation from one of our members here who recommends high cap, which is something somebody we've worked with in the past. And then they warn to beware of other services that are actually insurance agents working for commission. So that's appreciated.
Very, very, no, that's a very good recommendation. That's why I strictly stuck to the Medicare website, because that's just giving you straight data and there's no hidden agenda there. So that's a great.
Thank you, Kathy, for that. And she also provides the web address, which you guys can access in the chat, but it's California or cahealthadvocates.org, cahealthadvocates.org. Let's see, I'm just scrolling down here. There's some discussion between a couple of people, so I'm going to skip over that because it looks like that's been addressed. Thank you, Camille. UC Medicare Choice, United's Medicare Advantage plan for UC retirees
Includes
Part
yeah,
D.
so right, so that comment you see where it says Advantage plan, that's where it includes drugs, because it's all one plan through through commercial United Healthcare. So thank you, Ann.
And it looks like the last one in here for now is just to confirm, you are giving us information on the federal government Medicare, not the UC retiree health plans, correct?
So that is correct. The UC retiree health plans will be through the UC raise, and they should be able to do the same thing that I just did with you through their own system and tell you what the expected out-of-pocket costs will be. And those are, like mentioned by Ann before, those are Advantage plans. So all of the rules we talked about apply to it. It's just offered through the UC retirement system, and they may help with the I don't know if they help with the out-of-pocket expenses, but they like to keep it all in one place for you to make things as simple as possible.
Okay, it looks like a couple more have come in.
Okay.
UC Medicare PPO includes the drug coverage, correct?
If it's an Advantage plan like we discussed before, then yes. And a PPO would say that would be an Advantage plan. So yes, it should.
And someone asks, will UC Raise be presenting this type of Zoom as well? Well, that's a mystery to us. So yeah, I don't know.
Yeah, it'd be helpful.
Yes. Yes. I think I caught everything that came in on the chat. You can leave it open and see if anything else comes in. But it looks like we are all caught up, and here we got a new one. Here we go.
Okay.
How can we request UC Raise does this as well? That's a loaded question. Maybe emailed our office offline on that. Oh, Bonnie says she sent an email to UC Raise and they answered her questions. That's great to hear. That is a very positive thing to hear.
I will say, if she got an answer via email, that is the way to go then, because phone calls are difficult.
Yeah, they're facing some challenges right now, but yeah, thank you so much. They are overwhelmed and do not answer their phones, someone says. Okay, we will leave that at that. Oh, Bonnie got her response within a week.
Okay.
Good to hear. Good to hear. Okay. Unless there's anything else, Aisha had to step away. I will go ahead and close out the meeting unless you have anything to add, Michael, before we close.
Nope, I just appreciate you guys having me again. Always glad to help at least clarify anything on the pharmacy side of things for anyone moving forward into the Medicare world.
Yeah, and just before I close, thank you, Michael. Camille Carr, who many of you know, who works with CHR and has just been extremely helpful to probably all of us on this call, says good job. So we got her vote. I feel good. I can go through life feeling wonderful because that's very, very valuable. Thank you. And then someone points out that Bridgette Watanabe of UCLA provides Medicare orientation annually. Yeah, Bridgette's great too. If you need it, and I'm sure Aisha in her follow-up email will include some of these resources. And the messages keep coming in. So it looks like there's a lot of thank you for the informative webinar. And great info. Yeah, great job, Michael. Yeah, so nice. Wonderful.
Well,
I think
thank
that's
you.
it.
All right. Thank you guys again. And I hope everybody has a good rest of the day and rest of the week.
Thank you, Michael. And thank you to the rest of you for coming. And looks like Aisha's there if she wants to say anything before we part. You're muted. Maybe I can unmute you at this end, Aisha. Not sure.
Oh yeah, because I wasn't the host. So sorry about that. Yeah, thank you so much. It's always a pleasure to kind of go through the complications of Medicare. There's so many ins and outs that people really just don't know. So thank you, Michael. This might become a yearly thing if people still have questions. So we really appreciate you all coming here. If there's no other questions, you can go ahead and unmute yourself if you still have questions or go into the chat. But I think if everything is all taken care of, we will see you again next time. So again, this will be on the YouTube channel, hopefully by the end of today. If I can't get to it, definitely tomorrow.
Aisha, I don't know if you were able to hear the part about, I had thought that perhaps because there was some conversation about Camille and Bridgette and, you know, all of our wonderful resources here at UCLA. So if you are able to include those in your follow-up, that would probably be valuable and appreciated.
Yeah, so Bridgette Sheehan Watanabe is our healthcare facilitator, and Camille Carr and Robert Lariva, I will put their information in the chat. So if you're still at UCLA, you're an active employee, please utilize these resources we have with our on-campus counselors. And if you are a retiree, you still have access to using these campus resources. We want to make sure that people are aware of these different resources and referrals that we have at our disclosure. Not every campus has retirement counselors. So definitely utilize them because we fought long and hard to keep them at UCLA because with budget cuts, you never know who could be on the chopping block. So thank you all for going. When I post the YouTube session for Anna's question in the chat, it'll be on our YouTube channel. So I will put in the chat quickly our YouTube channel. It's something we started a pandemic ago. Since we're doing all of our recordings, we wanted to make sure people who couldn't make it could still see some of the videos that we coordinated. So let's see, I'm going to put in the chat our YouTube channel, and you'll just be able to watch it just like you're watching it right now with the Q&A and all the slides that Michael have. Will you send me the slides, Michael? Yes, thumbs up.
Yeah, sorry, I was muted. I'll send them over to you.
So I will send you the slides that Michael had. We also had this Medicare session last year, so you can also do a comparison to see what you may have missed last year when Michael was helping us. But yeah, so you'll be able to see that by the end of today, if not definitely tomorrow, so that you can rewatch it and also see the slides. Any other questions? Again, feel free to unmute yourself or raise your hand for questions.
What's the email address for the retiree? The do you have that?
For what?
Address for URaise?
Oh, for UC Raise?
Yes.
Okay, so
I have the website, but I don't have an email address.
you should, if you are a retiree, you should be able to log in with your UCLA login or your email.
It might be through a secure message through the
Oh,
UC Raise login. You can do a secure message.
Okay, thank you, thank you. Okay, that's why I don't have it. Okay, great. Thank you.
Okay, sure. Any other questions? Okay, I don't see anything. So thank you all so much for coming this afternoon. Have a great rest of your Wednesday, and we will talk soon. Thank you.